Edo State Governor Senator Gov Okpebholo has flagged off free malaria testing, treatment and distribution of malaria drugs to combat the scourge in the state. The governor said malaria is a major health challenge and his administration is determined to eliminate the disease in the state. The governor said over the next 2 years, his administration aims to ensure 80% of pregnant women in the state receive malaria prevention kits and treatment. He noted that 95% of people in the state will benefit and also reduce infant death caused by malaria to below 10%.
And with my commitment to affordable healthcare, over the next 2 years, we aim to ensure 80% of pregnant women receive malaria prevention medication. 2, 95% of the people with fever for malaria. 3, reduce infant death caused by malaria to below 10%. To make this happen, malaria testing and treatment will be free at all government hospitals and clinics in Edo State. However, we need everyone's support. While free testing and treatment are in place, raising awareness is key. We will run campaigns to ensure everyone knows about these services. Also, anyone caught charging for these free services will be disciplined accordingly.
Coordinator, Office of the First Lady, Adesili Anani Okpebholo, commended the Okpebholo-led administration for taking the laudable step in ensuring the people enjoy good health care. She noted that as easy and simple as malaria appears, it is deadly, even as statistics show that 30% of citizens of the state are exposed to it, adding that the state has taken steps to fight and drastically reduce it.
To our women, we're saying embrace this initiative. We're saying that malaria affects more women and children. We're here to make sure that our children live healthy. So we say what the government has done today with the partners, it's a good initiative. Embrace it. Mosquito nets, keep your surrounding clean. We have the malaria testing kits. Once you feel the symptoms of, well, fever, sometimes it's not malaria. Just go for the testing. It's free.
The Commissioner for Health, Dr. Cyril Oshomole, said the program is all about free malaria testing and treatment, which is sponsored by the Islamic Development Bank. According to him, for the next 2 years, all government hospitals in Edo State will receive patients for malaria and they will be tested and treated free of charge, warning that no health worker should charge for the service.
The patient comes with malaria symptoms. If you are treating for malaria, it's a different ball game. If you are treating for other infection, it's different. You know, infectious disease is broad spectrum. It can be of many symptoms or other diagnosis. But for the diagnosis of malaria, it's free. It doesn't mean that if you have typhoid, it's going to be free. We are specifically on malaria testing and treatment or management.
Director General of Edo State Health Insurance Commission, Mrs. Augusta Ikpea-Enaholo, said the commission is in alliance with the program ensuring every Edo State citizen is given affordable and free access to malaria medication.
The program is to ensure that every Edo State resident is given affordable and free access to malaria medication. This is a pandemic, and the governor has spoken that he's mandated to ensure that everybody in Edo State is free from malaria, and it's going to be free of charge.
The governor said to make this happen, his administration is making malaria testing and treatment free in all government hospitals across the state. John Asibo, JSTV News.